All right, well, good afternoon, everyone. I'm Stephanie Clendenin, the Director for the California Department of State Hospitals, and I am honored on behalf of the Department of State Hospitals and our team here at Napa State Hospital to welcome Governor Newsom and the legislators, local leaders, healthcare and service providers, and family members who joined Governor Newsom in the Care Court Roundtable today. The Department of State Hospitals operates the California Psychiatric State Hospital System. Napa State Hospital is one of 5 state hospitals that are located across the state. Last year, our system served over 7,800 Californians living with serious behavioral health conditions who were committed to the department through the criminal courts, the Board of Parole hearings, or who were under conservatorship. Too often, Californians with the most serious behavioral health conditions become fixed in a cycle of untreated mental health, homelessness, and incarceration, and also may be committed to a state hospital. While this is never the path that we want for our vulnerable and ill Californians, we are fortunate when it does occur that we have a dedicated, talented, and passionate team at our state hospitals to treat them. I would like to take a moment to thank and give gratitude to my entire team here at the Department of State Hospitals for their commitment to service and for caring today for a safe and healthy tomorrow. I'm grateful for the innovative and effective care, treatment, and services they provide to those we serve. We are honored to be the site to host the Governor's 3rd Care Court Roundtable. Care Court will help many Californians, like those we serve, get treatment and supports that they need to change the course of their mental illness and prevent them from entering the cycle that has led far too many Californians unnecessarily on a pathway to a state hospital. Now it is my pleasure to introduce Dr. Warburton, who is our statewide medical director here at the Department of State Hospitals. Thank you.
Thank you, Stephanie. My name's Kate Warburton, and I'm a forensic psychiatrist. And I chose that very specific subspecialty because of the very reason that we're here today. People who are living with psychotic brain diseases have been criminalized by our society. We're being symptomatic in terms of having psychotic symptoms, which impair a person's ability to understand reality. They hear things, they see things that aren't there. They lose insight into the fact that they have an illness. They lose their judgment. And what we're doing today is we're arresting those folks as they drift in conditions of unsheltered homelessness and untreated psychotic symptoms. I believe that we can do better, and I've devoted my career to that. Starting here on this campus as a provider, these patients are treatable. I had a unit of 36 folks who we were able to stabilize. They're beautiful human beings, and they deserve to be treated. And the way our current system works, they don't get treated until they're behind that razor wire fence, and that needs to change. I now work as our statewide medical director, and I'm watching this trend of criminalization, which the data support goes back decades, is increasing at an alarming rate, and our hospital system is no exception. We're seeing a year-over-year referral rate increase of 10% a year of people with schizophrenia who are being arrested on felony charges and inserted into this cycle of criminalization. I consulted experts from all over the world last year, and we published a textbook called Decriminalizing Mental Illness. And based on all of that expertise and all of my experience, I think that Care Court is the first time in my lifetime that we have a real opportunity to change the way that our society treats people who have psychotic disorders. It's not a mystery how to treat these individuals. We have the science. We have medications. We know that intensive psychosocial support, housing, and medication can keep these people connected to their families and in our communities. And Care Court has the potential to give us that. The beauty of Care Court is that in addition to that trifecta of medication, housing, and support, it's going to hold all of us who collect a salary for being a mental health administrator. It's going to hold all of us accountable to make sure that care is delivered. For that reason, I am here in full support of the Care Court proposal. Now it's my pleasure to introduce Mr. Stephen Boyd, LCSW. He's been the director of the Napa and Sonoma County Progress Foundation since 1989, and I had the pleasure of hearing his insights at our recent roundtable. Thank you very much.
Thank you, Doctor. Good afternoon. It's an exciting time and it's a challenging time in the development of California behavioral health systems. Governor Newsom's efforts, commitment, and dedication to serving those less fortunate of us is a testament to a moral obligation to help those in need. The Community Assistance, Recovery, and Empowerment Court framework has a potential to be transformative in a network of care for those individuals who struggle with serious mental health challenges compounded by substance use disorders. Our efforts to implement the Care Court pathway will require a concerted effort for all of us to provide an array of treatment services and opportunities that can optimize successful outcomes for those that are fortunate enough to get enrolled in the program. Developing individualized care plans and support services can assist enrollees to break out of a cycle of addiction and despair. Those folks we are attempting to assist in finding a better life for themselves need to be asked and listened to about what their perspectives are on the types, focus, and manner in developing a service delivery system that meets their needs and affords them the greatest opportunity to a path toward rehabilitation and recovery from very debilitating circumstances. Folks with disabilities need to be included in a responsive, dynamic, and relevant behavioral health system that is accessible and creates opportunities for change. I appreciate Governor Newsom's forward, innovative thinking, and I appreciate the legislature for supporting this initiative. Thank you, Governor. I'm now honored to introduce the visionary of the Steinberg Institute, Mr. Darrell Steinberg.
Oh, God, well, I wanted them to name it differently, by the way, but thank you very much, Stephen. Governor, members of the legislature, thank you. We stand on historic grounds. 55 years ago, the state of California made a well-intended public policy decision to reduce the population of state hospitals that house people with severe mental illness. And when they made that promise, I remember looking back at Governor Reagan's typewritten Department of Finance report. The state said it would pick up 90% of the cost of community care and treatment. And they also promised that local governments, the county specifically, would assure that the people who needed the help got the help. 55 years later, thanks to the leadership of Governor Newsom and the legislature, they have put forward now an unprecedented amount of resources. Maybe not enough, but an unprecedented level of resources to fulfill the first half of that promise. But there is a second half of the promise, and that is that we would actually have the policies in place to deliver the services and to make sure that people got the help that they needed. And that's why care courts, why this proposal is so fundamental and a response, and the right response to that promise made 55 years ago. Because what the governor's proposal essentially says is that government must be held accountable to delivering the services. Right now we've got, if we're honest about it, kind of a scattershot, fragmented system where many people of good intentions help as many people as possible. But it's not a system that delivers fast enough on behalf of enough people and responsive to the suffering that we all know exists out on our streets. And so upon a petition from the people who are out there to a court can say to the government, you are accountable to providing the services. And in the appropriate cases, the individual is responsible for saying yes. And I know that second part is controversial, but it's long past time for the pendulum to swing a little bit farther to the middle. And here's the difference and why I believe this proposal promises so much hope. Talking about involuntary anything in isolation is problematic because skeptics ask the question, well, where's the accountability to ensure that the person's going to get the help in the first place? The governor's proposal begins in a very real way to answer that question. Because if we're accountable for providing the services, then it should be less onerous to say that whatever it takes, the individual needs to accept the help as well. What's going on out there, and I'm now the mayor of a big city, is unacceptable. We all need to come to the place where we say loud and clear that bringing people indoors, getting them the help that they need, even if it isn't perfect, is essential compared to having people live in the kind of squalor that people are living in today. We need to support this proposal, and we need to continue to build the mental health system that was promised 55 years ago. It is my privilege now to introduce the mayor of Napa, Mayor Sedgley. Mayor.
Thank you, Mayor Steinberg, and thank you, Governor Newsom. Thank you for all my friends and colleagues here today to bring forth this important new step in our cities, our counties, and our state. The Care Court Plan addresses the core problem, the untreated. A client-centered approach, the Care Court model will catch those that have fallen through the cracks of our current fragmented system. Ironically, we gather here a former hospital that treated those Californians that justifiably and most importantly, humanely needed it. I would like to acknowledge the efforts and funding of this administration has put forth to make a true impact on the unhoused crisis in our state of California. The Napa community is a two-time Project Home Key awardee and hoping to apply in the third round. This has been a game changer in our ability to quickly respond to those unhoused and the most vulnerable people in our community. I know the mayors of the 13 largest cities in California, including Mayor Steinberg here with us today, have been involved in developing this program. As a smaller city, I look forward to learning how Napa can participate in the ongoing development and implementation of this program and what funding opportunities will exist to provide ongoing support for the wraparound services that will ensure this program is a success. Thank you for your work on behalf of Californians, in particular your work to help our unsheltered community members achieve permanent and stable housing. Thank you very much, and it is now my honor to introduce County Supervisor District 5, Belia Ramos.
Good afternoon. I would like to take this time to thank Governor Newsom for coming here to Napa County, including our stakeholders, the people on the ground doing this important work, and the roundtable discussion to discuss the intersection between behavioral health and homelessness that is affecting California's most vulnerable population. Governor, I applaud your desire to move in this innovative direction to address a multi-decades long problem. Here at the County of Napa, we have a history of working in a coordinated and collaborative manner with partners that carry out the care and wellness for each resident who walks through the doors of our courthouse, our correctional facility, and through Health and Human Services. But what we heard today is that we can all do more and we can all do better. On the front lines, navigating with residents the challenges they face is our compassionate and fearless leader, Ms. Jennifer Yasumoto, Director of Health and Human Services, who along with her team was at the table to share with the governor and his staff the challenges that our residents here face locally. I would like to thank my Health and Human Services staff here at the County of Napa, everyone participating, and all the partners that shared their expertise with the governor's staff so that together we can formulate a path forward that will make these innovative changes successful for the long term. All counties are facing challenges of coexisting homelessness and behavioral health. The counties of California, all 58, look forward to working with the governor's office to define the roles of counties, define the roles of cities as well, identifying sustainable resources, making sure we have diversified housing and necessary funding to support this transformative call to action. Thank you so much for including Napa as part of your exploration in this journey for the Care Court program. Next, it is my pleasure to introduce Assemblymember Richard Bloom.
Good afternoon. For context, my district is Santa Monica and surrounding community, so I'm a little bit away from home today, but it is a great pleasure for me to be here and to join Governor Newsom and my colleagues, as well as community mental health leaders who are here today, as we discuss this truly innovative approach to ensure that those who are struggling with mental illness and substance abuse receive the treatment, resources, and support that they need and deserve. The 2020 Greater Los Angeles homeless count identified 63,000 plus homeless individuals, and of that total, over 14,000 individuals were recorded as having a serious mental illness, and 15,000 were recorded as having substance use disorder. Now, many of these are the same people with co-occurring disorders. But as we work to overcome the homelessness crisis, we must ensure that these individuals have the treatment, resources, and support they need to succeed in healing and recovery. And that's why the Care Court is so important. The Care Court offers a new approach designed to help those suffering from untreated mental health and substance use disorders avoid conservatorships or incarceration by connecting these individuals to a care team in the community that can include clinically prescribed, individualized interventions with several supportive services, medication, and critically, a housing plan. I'm a big supporter of these special purpose type courts like veterans courts, drug court, mental health courts, and helped start a homeless court in Santa Monica when I served as mayor of the city. When properly funded and staffed, and when implemented at scale, and that piece is so important, we need to implement at scale, these courts can be a highly effective tool in addressing mental health, substance abuse, and homelessness. I've seen it work, and now we need to scale it up. So I look forward to working with the governor, my colleagues, and our community and mental health partners on creating a well-informed program and ample funding that will deliver the resources that these individuals need. It's now my pleasure to introduce my colleague and fellow Judicial Council member, Senator Tom Umberg.
Thank you, Assemblymember. My name is Tom Umberg, State Senator, Chair of the Senate Judiciary Committee. Governor, on behalf of our family, we thank you. On behalf of those who suffer from mental illness, we thank you. I couldn't be more enthusiastic, both as a professional, having worked on these issues since the Clinton administration, or volunteer in veterans courts or drug courts. I couldn't be more excited about this paradigm shift. We have some challenges. And we're here to help meet those challenges as your partner, Governor. Challenges in terms of resources. You proposed resources to really make this a huge initiative. Challenges in terms of workforce, making sure that the supporters are adequately prepared. Challenges in terms of the judges who are trained, who are, this is not the skill set that judges typically bring to this engagement. But I'm confident that we can make sure that we have both the workforce, the judiciary, who will embrace this, that'll make a difference. There are thousands of Californians who are depending on us. Californians who are here in Napa, there are Californians in my district, there are Californians and their families who are depending on us to make this happen. So Governor, thank you. We look forward to partnering with you to make this a success. And now it's my honor to introduce the pride of Winters, California, and that's Assemblymember Cecilia Aguilar Curry. Thank you.
Well, thank you for the introduction, Senator Umberg, and thank you, Governor, for inviting us here today to sit with my constituents and discuss this critically important issue today. It's time we face the painful truth, but obvious truth. Our behavioral health system in California is broken. All of us see it every day. Our unhoused neighbors face daunting realities living on the streets. Well, we as policymakers strive to find solutions to get them not only housing, but mental health services as well. We're all heartbroken by the crisis we're facing, but it's no longer enough to be heartbroken. We have to take concrete steps to lift up our unhoused neighbors, to get them not a Band-Aid, but comprehensive mental health and drug treatment services while providing durable housing as well. I look forward to seeing the details of the plan, and I am encouraged that we are moving aggressively to connect housing and treatment in a way that will uplift our neighbors from the most dire of circumstances to place a real hope and recovery. And now I'm proud to introduce Napa's own Senator Bill Dodd, my partner in crime in representing Napa and Yolo counties.
Thank you, Assembly Member. I appreciate the opportunity to be here today. I really want to take this opportunity to thank the governor and his team for coming to the Napa Valley today to have this listening session with so many of our wonderful experts here throughout Napa County. I also want to thank my colleagues, all the elected and department heads and experts that were here today. I'm not going to go on. I think I support what's already been said here. I want to move on now to really the main event, to listen to our governor, who has brought yet another innovative program in this space to us here in California. And we know, we all hear all the time from our constituents how big of a problem this really is throughout our state. Well, we're not sitting around, twiddling our thumbs. The governor and his team are really doing great work. We've seen it with Project Home Key. We've got this proposal here. Without any further ado, please welcome the governor of the state of California, Gavin Newsom.
Thank you, Senator. Thank you. Well, I think it's, first of all, let me just acknowledge, rare do you get community leaders, department and agency heads, rare do you get practitioners, experts in their field, but also 2 mayors, 2 assembly members, and 2 senators together for an event like this. I'm humbled and grateful, I mean it, to all of you that you would take your time out of your busy schedule to be here today, to have the chance to listen to one another and listen to different points of view expressed in the meeting we just had, including from the former presiding judge of the mental health court here in Napa County. It's good to be back here at one of our 5 state hospitals. This state hospital is well known in the state of California, and as Darrell Steinberg noted, this state hospital has gone through many different incarnations, not least of which, having just left a brief tour, you can see the vestiges of approaches and policies of the past. One notable vestige is a procedure room that still exists today in this hospital, where you see an observatory above the room where people observed lobotomies not that many years ago that were being performed consistently here behind these walls. The history of institutionalization, the history of deinstitutionalization, the history of a process that unfolded not in a single act, but over the course of many, many decades, with the advent of psychotropic drugs, with the advent of a civil liberties movement, with the advent of those that were looking for a different paradigm and approach, some that were more sincere than others in terms of providing those supports, particularly out of institutions like this back into the community. Nonetheless, one of 5 institutions of a type in the state of California, anywhere from 5,000 to 7,000 people, depending on the year, being served in these institutions, primarily those that are here under what we refer to as LPS, conservatorships, Lanterman, Petrus Short act conservatorships established in the 60s and under what we refer to as IST, those that are here in competence to stand trial themselves. These are the individuals that so often we come into contact with out on the streets and sidewalks, as was mentioned, that are struggling with addictions, struggling with the challenges of mental health, those with bipolar disorder, schizophrenia, paranoia, those broadly defined on the schizophrenia spectrum, or those with psychotic disorders that disproportionately, as was underscored in our meeting, are self-medicating with drug and alcohol addictions. Those that are duly diagnosed by definition and as a consequence need unique, individualized, and appropriate care, and often that is simply not available in a state that has provided scarce resources over the last 50 or so years. That, in the spirit of this event today, is about to change. In fact, over the last few years, it has begun to change. I want to just thank all the Assembly member leaders that are here and senators that are here for their extraordinary leadership. Senator Dodd couldn't be more right. We haven't just been sitting back passively on the issue of what's happening on the streets and sidewalks or in people's homes. Those that struggle, families that struggle invisibly every single day with a loved one, maybe themselves, that are struggling with behavioral health issues. We haven't been sitting back talking about the good old days, just pointing fingers. We've been in the process of designing a new approach and a new paradigm. And that's the spirit that brings us here today. $12 billion was approved just last year to advance our efforts to provide more housing, which is foundational in support, to provide more services ongoing, to provide the resources that are needed to get people successfully back up on their feet and back in their homes and their community and back to self-sufficiency. And this year, we're asking the legislature, in partnership with the legislature, for an additional $2 billion to advance that cause. 33,000 units, 33 specific, 1,000 units, 33,000 new units of housing and slots specifically for those struggling with severe mental illness and those that are struggling with substance abuse disorder. Those are resources that have never been presented in the history of the state of California. And that is just one bucket of funding, of many different buckets of funding. And perhaps one of the most significant buckets of funding that hasn't been highlighted as much as it should was the work we did last year with the legislature to provide $4 billion specifically for prevention services and screening services for our most vulnerable, our youth, ages 0 to 26. The state of California is doing what no other state's doing, $4 billion to provide comprehensive, universal screening and support for all our children 0 to 26 that are struggling. So many obviously been highlighted over the course of the last 2 years with the pandemic, but so many others that have been neglected for decades. California is stepping up in those efforts. So we have many different buckets of funding, many different approaches and strategies, but the one that brings us here today, and I'll briefly try to sum up, is this care court. It's a recognition that if you don't like the answer, you got to ask a better question. It's a recognition that if you continue to do what you've done, you'll only get what you got. It's a recognition that we need to do things differently. It's a recognition we need to ask better questions. It's a recognition that we need to find new approaches. We've been stuck, I'll be candid with you, stuck for decades in a stale debate about whether or not we should reform a system that was designed in a world that no longer exists. The LPS, other conservatorship frameworks that are well established here in the STEP, were established, many of them, in the 60s, well over half a century ago. The world's changed. The capacity now to get medication, injectable medications that are longer lasting, provides opportunities anew that didn't exist in the 60s. But our approach is consistently been framed in reforming those old paradigms, reforming LPS and conservatorship, reforming in the context of efforts like Laura's Law. And by the way, Laura's Law, we did reform a few years ago, but only 218 people were served last year. 218 people. You heard Assemblyman Bloom, our critical author, along with Senator Umberg, just mention LA counties severe mental health population alone, 218 people, and Laura's Law is just not going to do it. Nor are building more institutions respectfully like this, which is really an expression of our failure to go upstream to help people before they enter into the criminal justice system, before they're incompetent to stand trial, before they commit crimes and assaults on others, and often provide harm to themselves. And so we are looking at this anew, not reforming LPS, not reforming Laura's Law, though we can have those debates, and I embrace those debates, but leaping forward with this new paradigm to advance the cause that I think unites 90% of us in this state. What the hell are we doing about those that are struggling out on our streets and sidewalks? When can we hold ourselves to a higher level of accountability? I appreciate Senator Umberg talking about his days with the Clinton administration. I long talk about that frame that Bill Clinton himself advanced around community, opportunity, and responsibility. But what was missing, what is missing today, yes, community, critical, responsibility, opportunity, but accountability. We need to all be held to a higher level of accountability, each and every one of us. That's the spirit that Mayor Steinberg brought to this table. All of us, individually, collectively, individuals that include patients themselves. And that's why we want to approach this with a different referral process, open up referrals to provide more opportunity for people that are struggling, to provide a screening process and a care plan that has due process, public defenders, new community support, but also accountability for the individual to complete that plan, and for the county to be there to secure that plan along with the courts. And so our approach is novel in California's recent, perhaps historically, and our entire history, and it's an approach that we think is long overdue. We finance it, not just with money, but a more resourceful framework and mindset, being more creative and humble, that we need to be open, as I was saying to all of us earlier, open to argument, interested in the results or lack thereof that we produce as we advance this cause. So we're here in that spirit. I'm grateful for everybody that's leaning in. I'm grateful for the legislative leadership that's willing to take this baton. I'm grateful for the patient advocates. I'm grateful for the disability rights community. I'm grateful to all of those that are part of this process, those that express concern, as well as those that have expressed frustration, demanding reform, demanding change. We're poised to deliver on that, and I think it's long overdue in the state of California, and it can't happen soon enough. So that's the spirit of our visit. Gratitude again expressed to all that made it possible, and appreciation for those of you that showed up. And of course, we're here to answer any questions.
Hi, Governor. My name is Ashley Zavala with Nexstar Media Group. Now that you've had a chance to sit down with local leaders in a couple of these types of roundtables, do you have a better sense of how much this could cost? I know you've mentioned that $4 billion appropriation, but any idea on what a price tag on this program looks like?
I think what I'm hearing is we're already spending all the money. We heard Mayor Napa today talk about the costs just associated with the fire department here, and paramedics, police department, and the amount of money they're spending on overtime on helping folks on the streets and sidewalks over and over and over again, the cost of uncompensated care in your county hospital, the cost of a criminal justice system where judges, public defenders see people over and over and over and over again. The money is not the issue. I, with respect, would argue that's not the principal issue. Not with the incredible leadership of Darrell Steinberg and the mental health dollars that he's provided through Prop 63 and the public supported, increasing from $2.1 billion 2 years ago to $3.8 billion this year. Now with the $14 billion of new funding that, if we support this year's budget, will have been appropriated and applied to this issue just on the homeless housing and supportive service model. In addition, the $4 billion And I didn't even talk about all the other resources we're providing with our CalAIM proposal, which is the integration as the supervisor. And I thank the supervisor for being here. Her leadership has been demonstrable in this space, as she reminds us in every opportunity, the integration of brain health and physical health. All of those resources are now on the table, but those resources are also exhausted every single year in a completely fragmented, disconnected system.
Thank you for that. And thank you for the update on Care Court. For lack of a better term, I want to shift gears to your proposal that you made yesterday for the gas situation. One of the reactions that we're getting is on equity in this proposal that relies on vehicle registration and not tax records or income. Some have pointed to the example, an individual who owns a Mercedes-Benz and a Tesla, because electric vehicles are eligible under this plan, would be able to get $800. Your response to that kind of reaction to your plan?
It's not untrue. And I'm completely open. We made this clear yesterday, and I'll reinforce it today, to work with the legislature if they want to create a framework of means testing. In fact, we've already initiated that going back a week or so ago, looking to see what's possible in terms of the VIN numbers, the registration at the DMV, to make that determination of the value of the vehicles. So I'm very open to that discussion, but I'm also very resolved to get money back in the pockets of people that have been impacted, not just by gas prices, but across the board, every one of us impacted, all of us, by the cost of living and inflation and the other challenges we're facing that have only been exacerbated because of war in Ukraine and petrodictators that manipulate markets on a consistent basis. I should note that our proposal, like the other legislative proposals, moves monies to individuals, and it subsidizes the costs directly, not indirectly, by subsidizing corporations. We subsidize Californians. And our approach, we think, is a preferable approach. And that approach, I look forward to working with the legislature to advance and to adjust over the course of the next few weeks. And I'm confident we will land on an agreement in very short order.
Okay, one more question from me. Your office mentioned July was likely when the payments could go out. You and the legislature have been able to work in the past on urgency funding, COVID relief, paid sick time. Why not sooner?
Well, it's tens of millions of checks. We're still providing $10+ billion of checks to Californians from our Golden State stimulus. And I want to remind everybody, we provided $10 billion in stimulus checks, $600 checks, to roughly 3/4 of tax filers, or rather 3/4 of Californians in the state of California. And those dollars are still going out. It takes time to get those dollars out. As you know, the Franchise Tax Board currently is working on tax returns, which I think is a top priority for their distribution and administration. But we've got to work through the legislative process. We've got to approve a process, and then we've got to distribute either through direct deposit if we decide the FTB approach, or through debit cards if we do it the DMV approach, a process where we get those dollars out. So we look forward to getting those out. If you consider what we did last year, this is remarkable. And what we're proposing this year, $20 billion of tax refunds. No state in American history has ever provided that kind of relief. I'm really proud of that. And so we'll work together. We'll work through these issues. By the way, it's not just for cars. It's also to provide free public transit. It's also to provide hundreds of millions of dollars for more bicycle and pedestrian safety improvements. And I should note a distinction in our proposal that I think is important and I hope is highlighted. Many people are left out of other proposals, particularly people with Social Security disability benefits. They were left out of the Golden State stimulus. I don't want to leave them out of this approach. And that's why our approach with the DMV is a little different than the other ones being offered. I think SSDI recipients deserve these dollars. I think people without documentation that don't file taxes, that also own vehicles, could benefit from this. That's a different approach that we have than currently is being offered. And I believe our approach also will provide for people that don't file taxes for other reasons because they're low spectrum, that also own vehicles. So very low income people also are a beneficiary of our debit card approach, which again will just take a little bit more time, but ultimately will begin in the next 90 days if we indeed move quickly to resolve our modest differences between the legislative proposals.
Tom Bakar from Channel 2 KTVU in the Bay Area. I was listening and three questions popped up. Who cannot be taken to care court? How will you assure us that it's not abused by families and first responders? And thirdly, how will you assure that it's constitutional and not a full employment act for lawyers?
I don't know about the latter. It seems the Republican Party is consumed by the Full Employment Act for lawyers by weaponizing citizens to sue, as they're doing in Florida and Texas and elsewhere on a myriad of social issues to advance the cultural war. Our approach here is to mitigate the impacts and costs on the downstream in the criminal justice system, saving taxpayers money, saving the court time by having these specialty courts, and as Senator Umberg said, having specialty training to adjudicate the individual needs, to have a process which we are designing with the Judicial Council, to answer your question, to provide care plans that are court-ordered with support of public defenders and community advocates, and to provide some continuity of care that will reduce costs ultimately because people will be served in a more sustainable, less situational manner. As it relates to the current process, as you know well, we have on average over 100,000. In fact, I think a year ago it was 114,000 people that entered our 5150 system. That's a very costly proposal. You all are very familiar with 5150s, 5250s as well. 114,000 just a couple years ago that went through that system, a little less last year because of COVID and other related issues. The costs are borne across the spectrum in that space. And again, we are looking to reimagine, redesign upstream a system of care that would mitigate those costs, those points of contact, reduce bureaucracy, reduce the burden on the taxpayers, reduce, as one may reframe, a Full Employment Act, which is well established in the status quo, but in a fragmented and not sustainable way. So this is an opportunity to work with the legislature. We'll be providing the details of the plan to answer the question in more detail in April next month, and a process will unfold with the legislature and the public shortly thereafter, and of course over the course of the next few years as we implement.
Potential for abuse by either first responders or families that want to get rid of somebody they just don't want to have around anymore.
Well, one has to mitigate that, and that's why there's a public defender. That's why there's a court process. That's why there's not just a referral. There is a process of screening to adjudicate the merits or demerits of the same. So we're quite specific and quite prescriptive in terms of how that process unfolds, including new community supporters that are also a requirement of this process. So that's always going to be the case, but I will argue there is no greater case for the urgency of this initiative than the case that's made every single hour of every single day in the state of California as we navigate the streets and sidewalks and we see at scale the failure of our current system. That is abusive, and that is inhumane. To see the kind of abuses that are described in newspaper articles or on nightly news that we see on a weekly basis of some soul whose life is lost because we didn't have the courage to try something new, that to me is the ultimate abuse.
Thank you, Governor. I'm told that was the final question.
Great. Thank you. And with that, I just want to thank everybody once again for your extraordinary leadership and support and patience. As you can see, we've got a lot of important work to do with the legislature, and I couldn't be more blessed to have the kind of partners we have in Sacramento. Thank you. Take care, everybody.